Greetings. Welcome to AO. My name is Reuben Addo. I am the project officer for AO Alliance in Ghana. We are here to discuss on the problem of injury as a silent and neglected epidemic. And I'm joined here with two gentlemen who we are here to discuss on this important thing. And on my right is Dr. Klaus Renner, who is the past president of AO and also a member of AO Alliance. And on my far right is Dr. Joseph Mwanga, who is also the chair for English-speaking Africa for AO Alliance, covering about 14 countries. So my first question will go to Dr. Mwanga. Why is injury being seen as a silent and a neglected epidemic?
It's true. Injury is silent and neglected epidemic.
Yes.
Why? Because the world statistics is a little bit alarming that we know that 4.4 million deaths, they occur from injuries worldwide. But again, if you go down, find that it is 30% more compared to those people who die of HIV, AIDS, and other diseases. And also the 40 million injury-related deaths and deformities, they occur. So that if you come now down, you find that in low and middle income countries, it's almost 90% of the injury-related death and disability occur in those countries. And this is shockingly. Why? Because only 1% of the development fund directed to the health is directed now to the injury, management of the injury, compared to the 40% which is being directed to the non-communicable diseases. That's what I can say.
Wow. So in all this, Klaus, where does AO Alliance come in? What does it do based on all that he's just said?
Well, the AO Alliance is a non-for-profit development organization which is dedicated to strengthening care of the injured, and we are active in 30 low and middle-income countries in sub-Saharan Africa and also in Asia. Our vision is a world where timely and appropriate fracture care is accessible for everyone. Our mission is to reduce human suffering, disability, and poverty by implementing programs that enhance local fracture care capacity for sustainable impact. Now, what's important there are the two words local and sustainable. Local capacity, I think, is important. So it's not only a mission we are doing, we are trying to train the local people to then be able to take care, which I think is a much more sustainable model than just bringing in foreign doctors for a period of time. Our name tells already that we are looking for alliances with other partners, and we have been very successful doing so. So everyone who is also active with the same vision and mission is very welcome to join our forces.
That's good to hear. Joseph, you earlier mentioned that, injury is a global issue. Now, if it's a global issue, if we can translate it to the national level, for instance, Tanzania, what would you say to this?
Sure, it's an issue. I can say it's not silent in our country. That the 60% of injuries that occur, they're related to road traffic crashes. Now, if you narrow down and try to find out what are the entities, you find that more than 38%, they come from the motorcycle crashes, which is the mode of transport now for most of our people in that country. So now, this is the burden. Why? Because it is overwhelming. The healthcare system, sometimes it fails to absorb it. And it's very expensive to treat a patient with trauma because you need implants, you need ICU care, you need ambulance system. So it's a burden, and the age range is that it's a young generation between 15 and 45 years, and this is the engine that runs the family. And more than 70% are the males. You know, males in Africa are the ones real energetic, providing for the family. This is what I can give you as a snapshot in our country. It's a burden.
Based on what you said, I see how burdened the country feels when you say these things. But Klaus, I know you've been to Tanzania. What do you have to say in relation to, I'm sure you've observed a few things when you were there. How can you relate to what you just said?
Maybe I can just share with you my first impression when I visited exactly his hospital 10 years ago.
Okay.
At that time, this was probably the best equipped hospital in sub-Saharan Africa. Nevertheless, I was shocked, you know, because it was so overwhelming. There were wards of patients waiting to be operated. And if you look at the OR list, it was just impressive what they gathered there. So to me, as I said, it was a bit of a shock. And it was also a reason why I then was interested to start working with the AO Alliance.
Wow. Wow. And at least we have somebody who has observed the burden in Tanzania.
Yeah.
Joseph, I'll come to you again. Just take us through a typical experience of someone who gets injured and probably the leg gets broken. What's the whole process that goes in the whole thing?
The process is that it's quite unusual because most of our patients, they take a little bit longer time to reach the health facility because from the scene of the accident, getting to the primary health center, then they do whatever they can do, then refer these patients. So on average, if you're talking of Dar es Salaam as the city, which has more than 7 million people, sometimes a patient may take at least 4 to 8 hours to reach to the trauma center to get the treatment, proper treatment. But if it's from outside Dar es Salaam, maybe from other regions, and these patients are referred now to the regional hospital or regional referral hospital, reaching us or reaching the regional hospital may take more than a week. Sometimes there are patients we receive late, maybe 6 weeks, already with some complications and disabilities. So it takes a long time, although the system is working, but most of the time overwhelmed by the increasing number of the patients with injuries.
Maybe I can make a comment on that because this is, of course, something which is very different from Europe and the US, where you have all these systems organized. And that's why AO Alliance started to put up these country initiatives, which means that we focus on few specific countries where we do not only train the local people, but we also try to influence the healthcare minister, the government, in order to raise the awareness about injury problems, but also then helping them to design injury plans, so to improve the whole system. So AO Alliance is not only training and educating people, but also trying to develop full plans in specific countries.
Great. Now, trying to relate to what he just said, in Tanzania, what is AO Alliance doing to improve the care of the injured?
Yeah, that's a very good question. You know, care of the injured patient starts from the knowledge you have. Then it comes now to the facility and the ability of the healthcare individual to perform on that patient. So AO Alliance has been running many courses from the non-operative care of these patients, operative courses to the surgeons, and also operative courses to the residents. We have good number of residents, so they've been enjoying, they've been equipped with the knowledge from AO Alliance. And apart from that, most of us were sponsored by AO Alliance to do super specialized fellowships. I did my fellowship in Egypt on pelvis and acetabular surgeries. So when I went back to Muhimbili Orthopedic Institute, I made changes with our team, and now our center is part of training for our region. We get fellows from different countries. Recently now I have a fellow from Rwanda who is doing pelvis and acetabular. Last year we had a fellow from Zambia. And all these people, I'm sure when they go back, they'll make changes.
Exactly.
So this is a tremendous achievement through AO Alliance to our country and our region.
Great, great. Just based on looking at how you are speaking with passion, I would just want to find out your personal, experience ever since you joined AO Alliance. What has been the, a little description?
Yeah, I can say that I was breastfed by AO Alliance. I was very young when I joined the faculty, and I grew up by getting more trainings. I became the faculty. I did the faculty education programs. Then later on, I did my advanced course, went for the fellowship. Yeah. All these equipped me. Then later on, I became the member of the steering committee in various positions. And what I can say is that it's a very positive journey that changed my personal life.
Good.
And also, it was my vision to help others. And now, I'm there helping my people in that country, trainings, and also doing those surgeries, also nurturing other guys to become better than me. This is what I can say, that AO Alliance, it grew up me from childhood. Now I'm becoming adult, not yet old like Klaus. That's what I can say.
Well, but from what I'm hearing, it's a similar path like AO Foundation faculty would pursue. And this is, of course, not just, it's natural because we developed out of the AO Foundation. We apply the same teaching, and I think that's a great example you shared with us.
Yeah, sure. And recently I was invited to get involved in a coaching program. So I've been coaching in the basic principles course, enjoying so much, learning more, and also getting to know more activities in other countries while making connections for the better of our region.
Wonderful. I mean, I can see a lot of similarities in some of the things you've said in relation to my country, Ghana, and because of my association with AO Alliance, based on my observation, before AO Alliance came to Ghana, the situation was a bit different. We had very little resources, just about 2 training centers, less than 40 orthopedic surgeons, less than 20 residents. But since they joined, they came to Ghana since 2017, we have about 76 orthopedic surgeons, about 57, close to 60 residents, different levels. Now we have 5 training centers. I think they think it's too much, but they are working on it. It's just to say that AO Alliance has been impactful in some of these countries, and I can speak for Ghana. But using this, Klaus, we are going to celebrate 10 years in 2024.
That's correct, yeah.
How would you describe the journey and the impact so far?
Well, it's very interesting. You know, the AO Alliance started on building of projects which the AOSEC had already started in some countries. But then, of course, it went way beyond of AOSEC. That was the intention from the beginning. So I can share with you some figures. Again, we trained in the last 9 years more than 30,000 healthcare workers. This was done through more than 950 educational events overall. We also trained trainers to train the healthcare workers. This is a number of 300 plus, if I remember correctly. Reuben mentioned the fellowship, which was very important in his career. We were able to organize more than 400 fellowships during the past 9 years. And I mentioned before the importance of the country initiatives. So far, we have 5 country initiatives. We are about to start a 6th one next year in Togo. So overall, if you look at those figures, I think it's quite impressive. And also considering with how little funds this was possible to execute. We are always critical, and of course, we therefore asked a team of scientists to do an external evaluation of our doing. And I was not surprised, but very happy to learn that overall they see our activities over the past 9 years very positively. There are some tweaks which we need to make. I mean, this was to be expected, but in general, also we have a proof from the outside view that we are going on the right track.
That's wonderful. I mean, I'm very grateful for the insight you've shared, knowing the impact EU Alliance has, and I'm thankful for your time that you've given us. And so we just want to say thank you, and we'll see you again.